Hi, my name is Emily Cerda. I'm a microbiome specialist here with Tiny Health. Today, I'm going to show you the action plan and how to bookmark within your patient results. So here I am on the main page that you load into when you get your patient results. On the left-hand side, you're going to notice the menu bar where you can toggle between various functions. So here, I'm going to click on Action Plan. And what we'll find is that you're going to get actions based on your patient's results in the order that we really recommend that they tackle them. Of course, you can fit that to your own clinical needs based on your care with this client. But you're going to start with actions related to the red metrics, which are needs support. Here for this individual's kit, they did not have anything in the red in their results. So that's why this says nothing needs support here. And that will show up with nothing underneath it unless you actually click to see what's going on. The other thing that you'll notice underneath is that then we get into actions related to the yellow metrics, the things that are just out of range in your patient report. So here, you'll notice that there are a couple recommendations for this individual, and they are listed, like I said, in order that we have found importance for making the biggest difference in their gut health. So you'll see increase beneficial microbes for bifidobacterium, and then you'll see three different actions listed here. A lot of times patients believe that they have to do all three actions in order to move this metric, and that's not necessarily true. So you can help to guide them. If you can imagine, if you have a patient who has a number of things in the red, a number of things in the yellow, what will happen is that they will get a ton of recommended actions here, and it can feel quite overwhelming. So one way that we've tried to take that out of the equation, so that you're not getting calls and acting like this is an emergency, because they need to see you right away because they're feeling overwhelmed with their test results. You'll notice if you click into any of these, we'll go into the Bifido, for example. This is recommending a Bifidobacterium probiotic alongside an HMO prebiotic. You'll notice that we're talking about how to pick what tasks to assign to this action. So ramp up slowly, take for 6 weeks. Why we recommend it. There are always about sections about why we're recommending this that you're welcome to read. And then we do have some products listed here. What you'll find is that we also are listing the species that we're looking for in the products. So if you have your own products that you like, please use them and just go ahead and compare them to the species that we're looking for to make the biggest difference in gut health. You'll also notice next to these recommendations a little mark like this. So you can click on that and it actually makes a bookmark. And that bookmark will allow it to show up over here. If I click in the bookmark section, only the things that I have bookmarked will show up there. So often in talking with practitioners, we'll walk through the results. We'll talk about maybe what to do next, and they'll go in and maybe bookmark 3 or 4 things that they'd like their patient to do. And then they can direct their patient, look, we're going to have a call, maybe you're booked out and you can't meet with that patient for another couple weeks, but they're anxious to get started on their recommendations. Rather than feeling the overwhelm, you can tell them to just go check out the bookmark section. That's where we're going to start. You can even keep the supplement stuff off the bookmarks and only go into the food-rich things and say, look, I want you to start with some berries. Let's add some flax meal to some of your foods. And that would be a great place for you to start to begin with. So you can really take the overwhelm and help them take action, which is, I think, what they want when they call and they need an appointment immediately. So that's how the action plan and the bookmarking will work. You will also notice a section underneath the needs support and needs improvement related to those direct metrics that are out of range. You're going to notice a resources based on your survey section. This section, if I expand it, pops up if somebody has put something in their survey like constipation, eczema, reflux for infants, things like that, that aren't necessarily, they're more like condition driven, right? Or symptom driven. So here for eczema, we do list a number of actions that you can consider. Now, the difference between this and the things in the needs support and needs improvement section is that those are meant to really shift the microbiome to shift the metrics on this test. This one is less about shifting the microbiome itself and more about helping with what the patient is presenting with. So here, while we do have an evidence-based probiotic listed here, if we click into that, what's listed are some Lactobacillus rhamnosus GG options. And this lactobacillus is a transient species. It should not be shifting the gut microbiome on its own. And instead, one of its major actions is to support the immune system and to really push for immune regulation. So again, these things are under resources based on your survey. You can see here under eczema, we have digestive enzymes and hypochlorous acid spray, different nutrient deficiencies that are listed here that could be related to eczema. So there are things to help you kind of think beyond just what's showing up in the microbiome, since so many of these things are multifactorial. Maybe we need some immune support as well. And you see we list these food first here. Of course, as practitioner, you can always go ahead and supplement and dose appropriately for your patient. Additionally, underneath the resources based on your surveys, you will find additional resources. So, additional resources, if you needed to connect with a specialist, something like that, and you didn't have one that you're already coordinating with, you can find things there. You can also find things like probiotics for recovery from antibiotics. We do list some suggestions and some suggested strains for you to look for your own products if your patient has to go on antibiotics for any reason while you're completing this work. You'll also see some jumping off points for non-toxic cleaning products. All kinds of different resources here, fermented foods, getting dirty, which is a great one because we have a whole bunch of tips here based on all ages. So I hope this has been helpful to really orient you to the action plan and then how you can use bookmarking to really take that overwhelm out of your patient's experience.